this is Dr. Do again. This video is continuously from previous video talk about the systemic approach of medicine on the diseases associated with epithelia. And today I'm going to talk about another group of diseases that are associated with this epithelia, which are the glandular diseases. Actually, the diseases occur in the glands, either the endocrine glands, actually it's exocrine. Actually, if it's endocrine, it's not belong to this epithelia. Just the, a clear concept, because this epithelia lying on the tubule structure, and only those exocrine glands or organs have this tubule structure, which coated with this epithelia. Usually, the exocrine tubules of gland, those are the cubic cells, like the square shaped on top of the glands. For example, the salivary gland or other glands, and just like the tubule structure in the kidney. So these cubic epithelia also lining on the exogland tissue sometimes. And by the way, what is the endocrine, exocrine? This is the typical, it's too medical probably. The exocrine referring to those secretory glands have the tubule or duct connected to it. Just release the component, the whatever secreted into the adjacent structure. Not like the endocrine, however, on the other hand, there's no tubule structure or no duct. Just the chemicals secreted by those endocrine glands, transported by the blood or any other humors, and to the distance to function. For example, the insulin secreted in the pancreas and the function as the liver, function as the muscle, or adipose tissue to regulate blood glucose, or the hormones from pituitary. Those are all the endocrine, because the hormones secreted from the pituitary gland transported through the blood down to the tertiary organs like the thyroid, for example, and then also adrenal gland, etc. So this is just a little extension, because when I talk about the glandular disease, I talk about those cubic tubule structure, those cubic epithelial cells lining on the tubule structure connected to the gland, and also sometimes exogland itself contains these cubic cells. For example, the salivary gland, use that as an example. And also the lymphatic glands, lymph nodes, also have those sometimes associated with this cubic epithelia. So this is about the, so then talk about the glandular disease, depends what you're talking about. Usually those exocrine glands have the duct or tubule structure, like the sebaceous gland, just secrete. Those ducts actually opened in the follicles of hairs to the skin, for example. So if that is the fundamental, actually very common condition, the inflammation for those ducts, and also associated with the skin. So the skin is another, I think, the large organ containing a huge amount of epithelia. So associated with the skin, we know that in acne, for example, on top of the infection, on top of the blockage of those ducts, and then cause the infection, cause this acne. So this is typical, and also the lymph nodes sometimes and get inflamed, also belong to this glandular diseases, and also the other gland, salivary, for example, and also a lot of the epithelial cell itself serve as a gland. For example, in the digestive system or in the respiratory, the trachea, in between those either columnar or pseudo-stratified columnar cells, there's some glandular cells, actually called goblet cells. Those cells itself can secrete some mucus or some other structures along with this. So this, if that is if some diseases occur in the trachea, for example, the bronchitis, is because of those inflammation cause this cells proliferate, generate a huge amount, copious amount of mucus to cough out sputum. So that is another, I think, is glandular conditions associated with this epithelia. And the serious condition is carcinoma. Carcinoma is a glandular cancer, malignant tumor occur in the epithelia, particularly the glandular epithelia. It occurs in many organs, particularly for example, the thyroid can have it, and the breast cancer can have this, and also the digestive carcinoma of the colon. That's probably one of the most common malignancy associated with this glandular epithelia. So this is just the talk about the at tissue level, talk about disease, and the fundamental for taking home message about this cancer, carcinoma, of course, just emphasize again the screening when you have, particularly if you have chronic GI diseases, or if you have family history like polyps, or chronic colitis, or any other digestive disease like Whipple's, autoimmune inflammation of the mucus of the small intestine, large intestine. So if you have those risk factors, you probably need to be screened at younger age. But regardless, start at the years of 50, need to be screened by either the scope, and also probably every 5 to 10 years. Use either, depends on sigmoidoscope or the colonoscope. It depends on what the measure your physician prefer, and also the blood test, or cord blood test in the for screening. It's also important to screen the carcinoma of colon. And adenoma is another form of tumor occurred in the glandular epithelia, which is benign, and it can occur in many places. Adenoma either in the thyroid, for example, and also the adenoma in other locations. It is benign, it is quite common. I talk about the benign and the malignant. How to tell? Usually, so give you some idea. If you have something grow in the body, if you feel it, you feel it's very smooth and very well circumscribed, which means the border is very clear, and also it's very mobile, can move around. Usually, this could be painful, could be not painful. Usually this is the benign, relatively safe. But if it is really hard, or the shape is not regular, or it's really deep in the tissue, you cannot move it, that's probably is not a good sign, particularly the lymph node. If you have this kind of lymph node, you need to see a physician right away. Probably this usually occurs in older people, or the malignancy I just talked about. So this is about another group of diseases, from serious like carcinoma or minor like acne of the skin, occur in the glandular epithelia. I'm going to stop here. I hope it's not confused you, but really the take-home message is talk to your physician, do the regular screen with or without risk factor. Just if you have any concerns, just need to be addressed by the professionals. So I'm going to stop here today, and thank you for watching. I will see you next time.